Hi, I'm Dr. Michelle Gittler, President of the American Academy of Physical Medicine and Rehabilitation, and I have the Presidential Medal to prove it. For over 75 years, the AAPM&R is where PM&R physicians have come together. Academy members access this valuable PM&R community to build their network, for educational resources across all career stages, advocacy efforts to influence the future of the specialty, and opportunities to advance their practice to position themselves for success. Our community is shaping the future of physiatry, and we are stronger when we act together.
Hello, I'm Tom Stotzenbach, Executive Director and Chief Executive Officer of the American Academy of Physical Medicine and Rehabilitation. The Academy is an organization like no other. We are the leading medical association focused on advancing the practice of PM&R across all clinical areas and practice settings. We are a community of thought leaders who advocate for PM&R physicians and your patients. We are a provider of cutting-edge learning opportunities and much more. The Academy is dedicated to advancing the physiatric approach of optimizing function, performance, and rehabilitation outcomes with a clear focus on specialty advancement and the success of every member.
2020 has been an unprecedented year, but our PM&R community has pulled together to face these unique challenges. We continue to recognize the clinical, practice, and institutional obstacles that you have experienced throughout this year, and we want to continue to serve the specialty, bringing physiatrists together now and for the future of PM&R. As we reflect on the difficult lessons during this past year and look to the future, we stay strong in our commitment to advancing your bold vision, advancing our future.
The diverse perspectives of our PM&R community all work within the Academy towards our shared mission to lead the advancement of physiatry's impact throughout healthcare. PM&R physicians are essential to healthcare, and the Academy will continue to work towards advancing, documenting, and building recognition of the value of our community. In 2020, we moved several initiatives forward to advance the specialty. This 2020 annual report video will provide insights on these initiatives and how these efforts have laid the groundwork to continue our commitment in 2021. As we look ahead to next year, we will continue to support you by providing resources for community building, ongoing education, advocacy, and practice and career development.
Together, the specialty of PM&R boldly discussed its future. Together, we envision new practice models and areas of opportunity to expand the impact of our care. Now, we're working to advance the specialty, focused on action to make the vision for physiatry a reality. Our membership is working to advance PM&R Bold through game plans. Our peers developed the envisioned future and strategic plan for pain management and spine rehabilitation, adding this as a fifth practice area. Data. Recruiting early adopters into AAPM&R's registry to collect ischemic stroke and low back pain data to harness traditional EMR data with patient-reported outcomes data, which our registry accurately and efficiently captures. Branding. Our Specialty Brand Expansion Committee focused their 2020 efforts on the creation of grassroots materials and an eye to the future of influencing awareness of PM&R across healthcare stakeholders. Training. The Medical Education Committee has made supporting the needs of members in training, in fellowship, and in practice a key focus in order to meet the vision for our specialty. Work groups have been focused on developing core curriculum and training frameworks for the future. Workforce. Our focus is on a physiatry-led, patient-centered, team-based care. This year, volunteers gathered in work groups to discuss several workforce impacts and define our role in new settings. Advocacy. Whether it be advocating for PM&R's role in upcoming payment models or fighting scope of practice expansion battles to defend your role as the indispensable healthcare leaders in directing rehabilitation and recovery. AAPM&R's advocacy efforts remain a focal point of advancing PM&R Bold. Collaboration. PM&R Bold has always been driven by member input and experiences. Continue to learn and collaborate by visiting Phys Forum.
2020 has been the year no one expected, but that everyone will remember. The COVID-19 global pandemic has changed the world, not to mention how we practice medicine and support our patients. So many challenges and obstacles emerged, but PM&R physicians rose to the task. Throughout the pandemic, we have grown to become an even more collaborative society than we were before. The power of collaboration is strong within the Academy, and we are the reason. Throughout the spring and summer, we came together to create resources to aid our community. Despite the challenges of working virtually, you helped create the resources that your peers needed most. Take a look at some examples below of the valuable efforts we moved forward together. Dedicated web content. AAPM&R created the COVID-19 Physiatrist Member Support and Resource Center to keep us updated on the latest news and provide us in-depth resources created for physiatrists. New dedicated forum for member-to-member support. AAPM&R created the Care in the Time of COVID-19 forum on Phys Forum to help members share their experiences, challenges, and advice. More than 500 of us participated on Phys Forum across all forums this year. Hosted 20 plus COVID-19 specific webinars. AAPM&R held more than 20 webinars as an opportunity for us to hear from other physiatrist members and experts across healthcare on their experiences and ask them questions. More than 1,300 of us attended across March through July. New Physiatrist-Specific Resources. AAPM&R developed timely educational resources based on member feedback. Concentrated advocacy efforts. AAPM&R advocated for the federal support, legislation, regulatory relief, and resources that we needed at the time we most needed them. Here's just a small sample of the advocacy efforts during the COVID-19 pandemic created by our Academy and in partnership with other specialty societies. Graduate medical education-focused support. AAPM&R created a forum specifically for program directors to allow them to discuss their unique challenges in trying to form their residency program virtual curriculum, along with assistance for residents such as access to educational resources.
Thousands of PM&R physicians have found value, confidence, and power in the Academy of PM&R's community. Community is the basis for everything offered to the membership, providing spaces for us to learn, network, and advance our careers, while fostering a sense of belonging across all backgrounds and areas of expertise. One of the opportunities to meet a diverse group of PM&R physicians is through member communities, which allow us to connect with fellow physiatrists across the country in clinical, practice, and identity-focused communities. AAPM&R offers more than 40 member communities, and about 5,000 of us are involved in at least one of them. Throughout the summer, physiatrist members across the country pivoted their practice due to COVID-19. Several members shared stories of working in your communities, helping treat COVID-19 patients, and innovative ideas you have advanced and more. We as members are making a difference in our communities and our specialty. AAPM&R's commitment to community is the pillar of the brand. In 2020, the following opportunities were created to help us come together with our peers. Virtual town halls with our Board of Governors, a pediatric rehabilitation lecture series, which included more than 20 educational webinars, a summit for PM&R department chairs and division chiefs to discuss the rapidly evolving and increasingly complex environment they work in, and a research work group of member volunteers who had valuable dialogues about the research opportunities available during COVID-19 and how that research can take place.
AAPM&R's advocacy provides what individual PM&R physicians cannot easily do alone, and we are stronger when we work together to influence the trajectory of PM&R in healthcare and help advance the future of the specialty. Our academy is fighting scope of practice expansions that threaten patient safety and PM&R physician practices, tracking and influencing state and federal legislation and health policy issues, and advocating on behalf of all members and positioning PM&R physicians as essential leaders across the healthcare continuum. AAPM&R led multiple efforts to advocate against the CMS proposal that would allow non-physician practitioners, NPPs, to perform any of the inpatient rehabilitation facility or IRF coverage service and documentation duties that are required to be performed by a rehabilitation physician, which resulted in a big win for physiatry. By bringing together the unified voice of 2,377 PM&R physicians, 122 patient advocacy organizations, state and medical specialties, and prestigious IRF hospitals, as well as 97 of our patients, and gaining support from key congressional offices, we successfully defeated this CMS proposal that would have had a detrimental impact on patient care, the specialty, and the future of inpatient rehabilitation. Team Physiatry's success is driven by all of us. Thank you for being a PM&R advocate. We are aware that even though this is a major win for our specialty, it has not fully closed the door to future scope of practice concerns in the coming years. By working with and welcoming multidisciplinary team members, our academy optimizes the role of the PM&R physician and extends the opportunities and influence of PM&R physicians and the specialty. That's why AAPM&R continues to work with stakeholders and actively asserting that physiatry-led, patient-centered, team-based care is essential to providing optimized medical rehabilitation care for patients. Throughout the year, our academy tracked and influenced legislative, regulatory, and policy issues, participating in more than 25 coalitions to advocate on behalf of members and positioning PM&R practitioners as leaders in the future of healthcare. In 2020, AAPM&R has been pushing ahead, setting the agenda for the specialty at large and positioning PM&R at the forefront. This position statement was released to combat the inappropriate use of the specialty's name and protect those seeking care from the spread of misinformation about the specialty. CMS proposed an almost 11% cut to the conversion factor, which determines payment for services, and therefore AAPM&R is strongly advocating against this proposal. AAPM&R has long advocated to reduce burden for PM&R physicians by streamlining administrative documentation. CMS decided to remove the post-admission physician evaluation documentation requirement in its finalized IRF prospective payment system rule for 2021, which is a big win. CMS's decision to remove the PAPE is a direct result of our ongoing advocacy. Our academy's efforts have resulted in new office and outpatient evaluation and management code descriptors, documentation guidelines, and increased relative value units, or RVUs, which will go into effect on January 1st, 2021.
Members of the Inclusion and Engagement and Diversity and Inclusion committees have been collaborating this year to create our Principles of Inclusion and Engagement, which further advances our diversity and inclusion strategic goals and initiatives. Our academy is committed to embracing diverse backgrounds and perspectives of those with whom we work and serve, and creating space for the difficult conversations. These principles include valuing diverse group composition. And that entails recognizing a diverse group that is more representative of our overall membership composition can result in enhanced group outcomes. Volunteers can be selected as a member of a particular community to advance diversity of thought and experiences, but they should not view their role as a member for that community. Instead, they represent the entirety of PM&R. Mutual respect, demonstrating respect for differing opinions and viewpoints, cultivating a receptive space for differing opinions and viewpoints. Talent and skill-based selection for leadership opportunities, ensuring that broad criteria of diversity of experience, talent, and knowledge are incorporated. Removing barriers to involvement to further support an equitable environment to assure that all future leaders have the opportunity to to contribute where needed. Comprehensive collaboration. Building community between various member constituents is essential as a physiatric member association. Bringing different perspectives together will enhance innovative thinking and achievement. Critical conversations on equity, access, and inclusion in PM&R, healthcare, and society. Members were asked for feedback on advancing diversity, equity, and inclusion within our community. From listening to these insights, our Academy kicked off the Critical Conversation webinar series in July with Understanding the African American Physiatrist Experience. Please look forward to engaging in these valuable conversations.
Decision-making demands data. Factual evidence that your skills and services improve your patients' outcomes and are deserving of an institution's referral or a payer's reimbursement. You asked for data to prove your value, and AAPM&R answered. The accurate documentation of rehabilitation through data involves all of PM&R, and the effort is being led through the registry. Together with member volunteers and technical expertise, AAPM&R developed and refined the architecture to collect the specific data points we need to seamlessly and effortlessly prove our value as physiatrists. Using a unique framework which harnesses traditional EMR data with patient-reported outcomes data, the registry accurately and efficiently captures essential data, transforming it into real-world evidence through smart analytics and intuitive, flexible reports. This year, our registry welcomes 6 early adopters as of September 2020, organizations that are committed to quality improvement through clinical and patient-reported data collection in both ischemic stroke and low back pain. This started off with these 2 areas, but plan to expand soon, knowing PM&R impacts outcomes for many other patient populations. Our early adapters and bold strategic areas will help us decide which areas to focus on next. To encourage other practices and institutions to participate, AAPM&R hosted a series of critical conversations to engage with members on the need and importance for PM&R to define what quality care means to the specialty.
AAPM&R plays a critical role in our success every day. PM&R physician members are supported through practice and career advancement resources that create everyday value for us and help position us for success in the future. Member volunteers are stepping up as PM&R leaders are driving the specialty forward. The Specialty Brand Expansion Committee has been focused on developing grassroots marketing support for members and creating strategies to increase PM&R's brand value with key stakeholders, primary care and hospital healthcare administrators. The grassroots marketing support in 2020 has included helping refresh PM&R knowledge now by creating patient-facing content and PDFs on conditions and treatments that members can distribute to their patients. These templates cover a wide variety of clinical topics, along with an explanation of what PM&R is and what makes PM&R physicians unique. Your career is our specialty. 2020 has thrown us curveballs left and right, but AAPM&R's support for us has stayed constant. They recognize that advancing our career is a priority, which is why there are continued improvements in the resources offered to us. The Job and Fellowship Board, new positions are regularly added. Browse the board to see what's available or post your job opening. The Job and Fellowship Fair, offered virtually this year on November 13th. You'll be able to connect with a variety of companies across the country. PM&R Journal. New research is published monthly and sent to our mailboxes. The PM&R Journal has several successes this year, including more than a 20% increase in manuscript submissions, a new mobile app, 4 new senior editors who joined the editorial board, and more. The Physiatrist. The official membership newsletter delivered to our mailboxes, which contains the latest career resources and job openings. Career Corner, our monthly professional development e-newsletter designed to help connect you to your dream job. Helping early career members transition into practice. Early career PM&R physicians face unique challenges as they navigate new work responsibilities and juggle work-life balance. The Early Career Pathways is offered as a special membership option for those graduating from residency and fellowship. With feedback from residents and early career physiatrists, there are 2 pathways to allow newly graduated residents and fellows to continue their academy membership at deeply discounted rates. They receive academy benefits along the way, discounts, a payment plan option, and more, which all leads to a complimentary annual assembly registration once they complete the final pathway. It's a great option to stay connected with 1,500 plus residents and early career physiatrists in the PM&R community and receive valuable resources along the way, all while being rewarded. Plus, in 2021, regional virtual courses for early career physiatrists will be offered as another opportunity to connect.
Education is a fundamental offering that affects PM&R physicians across clinical focuses, practice areas, career stages, and levels of expertise. As part of Academy membership, AAPM&R provides top-notch education and other innovative learning resources across a variety of delivery mechanisms. A combination of online education, virtual courses, and live events keeps our specialty on the cusp of healthcare changes and medical advances, supporting members in their pursuit of ongoing education and preparing them for practice and career advancement. Digital learning. A new exciting offer is an online education subscription, which is now available. When you add a subscription to your membership, you receive 24/7 access to online educational resources, including instructional videos, podcasts, case studies, and more. Virtual and in-person learning. A variety of STEP certificate programs are also offered to keep PM&R practitioners at the top of their game, supporting early career physicians and seasoned professionals who want to represent the highest standard in the field. Designed by physiatrists for physiatrists, concussion and mild TBI join the highly regarded ultrasound and spasticity programs with both online and live learning formats in 2021. National Grand Rounds are monthly webinars to connect PM&R physicians of all specializations from across the country for stimulating discussions on topics that represent the intellectual, practical, and/or spiritual aspects of the specialty. To learn more, visit aapmr.org/education.
As the premier physiatry-focused event of the year, the PM&R community came together for the 2020 Virtual Annual Assembly, an online event never experienced before. Members of Team Physiatry are meeting virtually to connect, learn, and grow with their PM&R community. The exchange of information and expertise has never been more critical. Be sure to save the date in your calendar for the 2021 Annual Assembly, November 11th through 14th in Nashville, Tennessee. Additional details will be posted on www.aapmnr.org/assembly.
Thanks to your engagement in 2020, you've helped make our PM&R community special through member communities, advocacy efforts, webinars, virtual committees, and work group meetings, and so much more. Continue showing your PM&R spirit in 2021 by maintaining your Academy membership. I encourage you to visit aapmnr.org/membership to view all your benefits and more. To learn more about our efforts to advance the specialty and the success of each member, visit the full 2020 annual report at aapmnr.org/2020 report.